If your blood pressure suddenly spikes, would you know how to lower it in under 2 minutes? Without pills? Most seniors don't. And that's why this video is so important. Here's something few people are ever told. Your breath has more immediate control over your blood pressure than most medications, not supplements, not special devices. Your breath. When blood pressure rises, it's often because your nervous system is stuck in stress mode. Fast, shallow breathing tightens blood vessels and pushes pressure higher, but slow, controlled breathing sends a powerful signal to your body to relax. And when that happens, blood vessels widen and pressure can begin to fall. And this isn't theory. Over years of clinical practice, doctors have watched patients reduce their blood pressure response in real time using simple breathing techniques, sometimes enough to delay or avoid additional medications. Research published in respected hypertension journals shows that slow, guided breathing can lower systolic blood pressure by numbers comparable to adding another drug, without side effects. Yet almost no one teaches this. Why? Because there's nothing to sell. In this video, I'll guide you through 3 specific breathing techniques, step by step, counting every second with you so you can feel the calming effect as you watch. You'll learn exactly when to use each technique, whether your pressure rises from stress, poor sleep, or sudden anxiety. Stay with me until the end, because the 3rd technique is the fastest for sudden spikes. And before we begin, tell me in the comments, have you ever felt your blood pressure rise suddenly? Yes or no? Let's start with the first breathing technique right now. If your blood pressure suddenly spikes, would you know how to lower it in under 2 minutes? Without pills? Most seniors don't. And that's why this video is so important. Here's something few people are ever told. Your breath has more immediate control over your blood pressure than most medications, not supplements, not special devices. Your breath. Let's start with one of the most powerful and well-studied breathing techniques for calming the nervous system and supporting lower blood pressure, the 4-7-8 breathing method. This technique may sound simple, but it has deep roots in traditional Indian yoga practices and is now widely recognized by pulmonologists and heart specialists for its ability to slow the heart rate and relax blood vessels. Here's why it works. When you're stressed or anxious, your breathing becomes fast and shallow. This activates your sympathetic nervous system, the fight or flight response, which tightens blood vessels and pushes blood pressure higher. The 4-7-8 method does the opposite. By slowing your breathing and extending the exhale, this technique activates the parasympathetic nervous system, often called the rest and relax system. When this system turns on, your heart rate slows, blood vessels begin to widen, and blood pressure naturally starts to come down. How to do the 4-7-8 breathing technique. I'll walk you through it step by step. Inhale quietly through your nose for 4 counts. Hold your breath gently for 7 counts. Exhale slowly through your mouth for 8 counts, as if you're fogging a mirror. That's 1 cycle. You can repeat this 3 to 4 times, especially when you feel tense, your pressure feels high, or you're trying to relax before sleep. The extended exhale is especially important. It signals your nervous system that you are safe, allowing blood vessels to relax and circulation to improve. Important safety note. There is one important caution to mention. Holding your breath briefly increases carbon dioxide levels in the blood. For most people, this is beneficial and helps slow the heart rate. However, people with COPD or chronic breathing difficulties may already have elevated carbon dioxide levels. For them, the breath-holding portion can feel uncomfortable. If you have COPD or difficulty holding your breath, it's best to skip this technique or shorten the breath hold and speak with your doctor first. Now let's move on to technique number 2, known as box breathing, a simple but powerful method used not only in medicine, but also by athletes, military personnel, and emergency responders to quickly calm the body under stress. Box breathing works by creating a steady rhythm that directly influences your nervous system. And your nervous system plays a major role in blood pressure. Here's how to do it. Inhale slowly through your nose for 4 counts. Hold your breath for 4 counts. Exhale gently through your mouth for 4 counts, hold again for 4 counts, then repeat this cycle for 1 to 3 minutes. The reason this technique is so effective is because it helps shut down the stress response. When we're anxious, rushed, or tense, our breathing becomes fast and shallow. This signals the brain to release stress hormones like adrenaline and cortisol, which cause blood vessels to tighten and blood pressure to rise. Box breathing does the opposite. By slowing your breathing and adding short, controlled pauses, you activate the parasympathetic nervous system, the body's rest and relax mode. As this system takes over, your heart rate slows, your blood vessels begin to relax, and blood pressure naturally starts to come down. What makes box breathing especially helpful for seniors is its predictability. The equal timing gives your brain something simple to focus on, which reduces mental tension and emotional stress, two major contributors to blood pressure spikes. Many people notice that after just a few rounds, their shoulders drop, their jaw unclenches, and their breathing feels deeper and easier. These physical changes are signs that the body is moving out of stress and into balance. The third breathing technique may look simple, but it's one of the most powerful tools your body already has for calming the nervous system and lowering blood pressure. Diaphragmatic breathing, also known as belly breathing. Unlike shallow chest breathing, which activates stress hormones, diaphragmatic breathing engages the parasympathetic nervous system, the part of your body responsible for rest, relaxation, and recovery. When this system turns on, heart rate slows, blood vessels relax, and blood pressure begins to drop naturally. That's why this technique is especially helpful for seniors who experience blood pressure spikes in the morning, at night, or during moments of anxiety. Here's how it works. When you breathe deeply into the abdomen, your diaphragm moves downward, gently massaging internal organs and signaling the brain that you are safe. This reduces the release of adrenaline and cortisol, hormones that tighten blood vessels and raise blood pressure. At the same time, oxygen delivery becomes more efficient, helping your heart work with less effort. To practice diaphragmatic breathing, you can sit comfortably or lie down. Place both hands on your abdomen. Inhale slowly through your nose and let your belly rise like a balloon. Then exhale through your mouth, gently pulling the belly inward, as if your belly button is moving toward your spine. What's important here is where your attention goes. Instead of focusing intensely on airflow, which can sometimes increase anxiety, you focus on the movement of your hands rising and falling. This makes the technique especially suitable for people who feel uneasy when concentrating too much on breathing itself. Unlike shallow chest breathing, which activates stress hormones, diaphragmatic breathing engages the parasympathetic nervous system, the part of your body responsible for rest, relaxation, and recovery. When this system turns on, heart rate slows, blood vessels relax, and blood pressure begins to drop naturally. That's why this technique is especially helpful for seniors who experience blood pressure spikes in the morning, at night, or during moments of anxiety. Doctors often recommend diaphragmatic breathing first thing in the morning, before bed, or anytime blood pressure feels elevated. It's also extremely helpful for people who struggle with sleep, nighttime anxiety, or racing thoughts, all of which can drive blood pressure higher. Unlike techniques that involve breath holding, diaphragmatic breathing is gentle, continuous, and safe for most people, including those with mild respiratory sensitivity. Practiced consistently, this technique trains your body to stay calmer throughout the day, not just during the exercise, helping support healthier blood pressure over time. As we come to the end of this video, I want you to remember one simple truth. You don't need a prescription, a supplement, or special equipment to influence your blood pressure. You already carry one of the most powerful tools with you, your breath. The 3 breathing techniques we practice today work because they communicate directly with your nervous system. They help quiet stress signals, relax blood vessels, and allow blood to flow more smoothly. For many seniors, this can mean calmer moments, fewer pressure spikes, better sleep, and a greater sense of control over their health. These techniques are not meant to replace medical care. Instead, They are supportive tools. Tools you can use anytime, anywhere. When you feel anxious, when your heart feels like it's racing, before bed, or when your blood pressure tends to rise. The key is consistency. Even a few minutes a day can help train your body to respond more calmly to stress over time. Before you go, I'd love to hear from you. Which breathing technique felt easiest or most comfortable for you? Leave a comment below. Your experience may help someone else. If this video helped you, please subscribe for more senior health tips focused on simple, natural ways to support your heart, circulation, and overall well-being. Thank you for watching, and take a deep breath. You're doing something good for your body. Doctors often recommend diaphragmatic breathing first thing in the morning, before bed, or anytime blood pressure feels elevated. It's also extremely helpful for people who struggle with sleep, nighttime anxiety, or racing thoughts, all of which can drive blood pressure higher. Unlike techniques that involve breath holding, diaphragmatic breathing is gentle, continuous, and safe for most people, including those with mild respiratory sensitivity. Practiced consistently, this technique trains your body to stay calmer throughout the day, not just during the exercise, helping support healthier blood pressure over time.